So Mo, thanks for taking time.
My pleasure.
I want to discuss Focal One, but I also want to compliment you, Vip, and the team on putting together an unbelievable event here. I can't even believe I got you in the chair there.
It's fascinating, Joe. I mean, and you've seen this for several years. The momentum, the growth, it's unbelievable. We just look back on like 2019, prior to the pandemic, this meeting, we thought it couldn't get any bigger, and we're double that size now. So it's grown very internationally. We've got people from 55 countries here, and it's kind of gratifying to see just how much interest there is in medical robotics and digital technologies, and all the ways that we're advancing across so many fields. It's exciting time.
And pulling off the coup of pulling off the FDA here, I don't know any other event that's pulled off the FDA to have an open forum like
well,
that.
Well, I got to tell you, when Vip first approached me and said, I'd like to engage the FDA to speak directly to industry and surgeons at this event, I kind of thought his reach had exceeded his grasp. And in reality, they were so open. And what I loved was Dr. Asher from the FDA, the director of the office that we were speaking with, said, we view education as part of our core missions. And that totally changed my thinking as you know, the big bad regulator, to thinking, no, their job is to educate. Obviously, they're going to maintain their own equipoise in making decisions, as they should, but they really wanted to educate. And once we got into that framework, it was a great partnership.
It was. That flowed and was over way too fast.
Yeah.
So let's jump into your day job, Focal One.
Day and night
This
job.
is your side hustle.
Right.
But Focal One, for our audience that might not be familiar, take them through what the technology and the solution is.
Sure. So Focal One is robotic high-intensity focused ultrasound. And primarily what we do is we use sound waves that are highly focused and precise at a millimeter by millimeter level to be able to ablate tissue. And our primary indication right now, and the way in which we're used across dozens and dozens of countries and treating thousands of patients each year, is in prostate tissue ablation. So we now have the ability to really localize disease. Where we were even 15 years ago was you might do a biopsy, 12 cores, sample 4% of the prostate gland, and potentially miss up to 30% of clinically significant cancers. So if you found any cancer, in the back of your mind, the thought was there may be more cancer lurking. So let's go for a whole gland radical treatment, either remove it or completely radiate it. And so now the precision in imaging has opened up a whole new world for precision in treatment. And that's what the Focal One is enabling, is we're combining the best-in-class imaging, being able to overlay MRIs or biopsy maps onto a live ultrasound picture, and then using very precise dynamic focusing technology, we're able to sit there in a non-invasive outpatient procedure, takes about 45 minutes usually of treatment time, and we're just ablating that area of the gland that has cancer, and we're leaving everything else untouched, with obvious very important benefits in terms of preserving sexual function and avoiding incontinence. And so it really needs to be on the menu of options for men, and we can tailor non-invasive treatments depending on how severe and the location of their cancer.
And is that the single focus of the platform, or can you expand that out to other indications?
Well, something that we're really excited about is we just received an FDA breakthrough designation for clinical work that we've done in endometriosis. So many women who suffer from endometriosis, it's such a prevalent condition, and there's so many different levels of severity. And the most difficult is deep infiltrating endometriosis. And for many of these women, the only alternative for relief and to kind of regain their life is a colectomy, a pretty invasive surgery. And so we're thrilled with the data that's come out and been published and presented at meetings like AAGL. This meeting's great because there's a number of thought leaders in the gynecologic space as well. And they're very open to this idea of a non-invasive treatment where you can ameliorate the symptoms for these women when the only other alternative is a major surgery. So we're really thrilled about that, and we're eager to continue to work with the agencies to get this approved in the US, and then we can speak about it further.
What has enabled us to now take that HIFU technology? Is it the advanced capability of imaging that has allowed us to be a lot more precise and a higher fidelity data set in order to now apply that energy?
You know, it's a number of technologies that are advancing simultaneously, and also our know-how And you know, that's really the clinicians who are taking these enabling technologies, like robotics, right? I mean, it's a tool, and ultimately you put it in the hands of the right thought leaders, and they find ways to utilize it in very effective ways to treat specific cases. So for us, the technology enhancements really are, as you said, imaging. Without that, you know, you are flying blind. But also we've seen a lot of advancements in the core of focused ultrasound technology, and there's a number of other applications of focused ultrasound that are phenomenally interesting, like in essential tremor for patients and recovering their quality of life in the brain. But what we're finding is we can now deliver that energy with transducer technology where you're passing through tissue very safely, it's not like radiation, and you can deliver a focal point where you're able to have a tissue response that you want in a very, very small area. So the transducer technology has really advanced so far, so that therapeutic ultrasound is now a very real thing with big applications. And then, you know, the word robotic is not just thrown around to, you know, to sound good on the t-shirt. What we're trying to do is actually utilize robotic enhancements so that we now are sensing certain things. So our new technology, for instance, senses and position of the rectal wall, which in this treatment, you want to avoid putting any energy in the rectal wall. You want to go past it to treat anatomy, but you don't want to have any influence on that. So we're constantly monitoring, maintaining a 3 millimeter safety margin, and if there's any slight movement or adjustment of the patient, we adjust for it robotically. Previous generations, really you had to constantly think about it and make physical movements as a surgeon. Let the robot do that. That's the kind of thing that the robot can do much more precisely than a human can, and you can focus on the clinical judgment aspects of it.
Yeah, so taking that physical load and even cognitive load, and then allow the physician to make decisions without having that load on them unneeded. And that's one of the things that robotics really does, doesn't it?
It does.
It removes that physical and overload on the cognition side to be able to think about practicing medicine versus hands, wrists, elbows, the burden of, am I far enough or close enough away?
Yeah, exactly. I couldn't agree with you more, and we think a lot about the user experience. I think you think about us as consumers, right? I mean, we know a good product, we know a good user experience from a poor one, and yet in medicine, I think we love the complexity and the bells and whistles. And I think the challenge for us as manufacturers now is to continue to add feature sets and capabilities, but to be very thoughtful about how we train and create usability for not only the surgeons, but their staff as well.
The care team.
And that's so important in the design process of medical devices, or you're going to have problems.
That came up the other day, I think, at Dave Rosa when on the intuitive session. I'm fascinated by the organizations that do exactly what you said. Continue to introduce complexity, but make sure none of that complexity gets transferred to the care team or the clinician, but they still get to experience the use of it.
Yeah, it's every situation is unique, every situation is different, and one of the challenges we have is sometimes at a meeting such as this, you have so many thought leaders, and there are one or two standard deviations beyond the norm in terms of wanting to have more information and more variability at their fingertips. And so you have to balance that and get feedback and design inputs from people that maybe aren't going to use this 8 times a week, but might only use your device once or twice a month, and yet you still want them to be able to offer a really high quality experience to their patients. So, that's the challenge in the design process. It's fascinating, and you've got to look at feature by feature and how you enable that.
Agreed. Well, Mo, thanks for the time. Congrats on Focal One. And continue. I think we have another day and a half here in Orlando at SRS 2024.
Thank you. And thank you, Joe, for all you do to help create awareness and understanding of all these important changes. It's been a pleasure.
It's a privilege for me.
Thanks so much.
I'm Joe Mullings from Orlando, SRS 2024. Be well.